I think my journey into medicine is fairly typical of most other doctors. For myself, at least, I wanted a job that wasn't office bound. I didn't want a 9 to 5. I wanted a job that offers me on day-to-day work something that is going to vary every day. And I guess then at some point I started gravitating towards consideration of medicine. Now, as for colorectal surgery, I actually started off during my housemanship years wanting to be what we call an internist, which is an internal medicine. I still remember I did my first surgery postings in Alexandra Hospital. I dreaded it. I said, okay, I'm not going to be a surgeon. I just want to finish out the posting and be done. And then one thing led to another, a few inspiring consultants and a few trips to the theatre. And then that gravitated and kind of changed my mind. And then eventually that's where I ended up with. I don't think I came out with the idea of a mission or statement per se, but there were a few things that I felt I wanted to do when I first come out to private practice. I think first off is I wanted to ensure that the plans or the medical plans, surgical plans that the patient had is clearly coming from myself and that it is executed as per what I wanted. Now, this is in contrast to, of course, due to the volume of patients that we had in the restructured hospitals, where a lot of times, sometimes as you pass instructions to your team members, by team members means your mid-level registrars or your medical officers or house officers, sometimes it gets lost in translation. And of course, on follow-ups, there is no way the consultant sees every single patient. So what happens is sometimes, a lot of times in fact, it's your registrars or your junior doctors who are seeing the patients, and sometimes what they order for the patients or what the plan is not what comes to my mind. So for me, one thing is very clear is that I wanted the surgical plans or the treatment plans for my patients to be exactly what I had in mind without any ambiguity. I think number two, of course, boils down to personal preference or personal beliefs, and I always wanted to give patients a little bit of a choice when it comes down to choosing what treatment plan they want, something that may not be available when you're in restructured hospital. And of course, it boils down to, I guess, every individual doctor's preference and way of doing. So from my end, I always want to give patients choice and know what their options are and have time to consider. So I think that's another thing that I generally do. We see a variety of patients, but I think generally in the private healthcare sector in Singapore, we tend to see patients who are of younger age group and generally so-called more well than what we tend to see in the restructured hospitals, where certainly a very large portion tends to be the older population, and then they tend to have more medical issues, and of course certainly could be in a much poorer state of health. But certainly I do see a fair bit of patients with a lot of gut symptoms, either the upper gut, which is what we call the stomach and esophagus, or the lower gut, which is what we call the colon. And of course, notwithstanding a lot of conditions around the anuses, including things like abscesses, like fistulas, some terms of which may be fairly foreign to some of the people listening in. And of course, certainly a lot of skin cancers, skin lumps, large tumors, what we call soft tissue tumors of the muscles, the skin. So I think that essentially forms the bulk of my practice. And I think certainly as a doctor, we can't run away from doing emergency or on-call work. So certainly I get calls very often from the hospital's emergency department to do something along the lines of appendixes and infected gallbladders and infected abscesses and all. They will expect very friendly greetings and service from my 4 staff, my 4 golden bells. And I think that's essentially, I think the key thing when you look at the reviews, you'll see what most of our patients say, which is from the staff outside is a very friendly and warm environment. For myself, I'm not too uptight with my patients. I often do tend to divert a little and ask a little bit more about what do you do, what's your occupation, and then along the way, sometimes the conversation goes around to something relevant a little bit to their whatever they do. So sometimes that I divest a little. But when it comes down to the medical side of things, a fairly detailed questioning, history taking, and certainly a lot of discussion about what your options are, what needs to be done, to the extent of sometimes I even say, maybe my girl said sometimes I'm a bit long-winded. I think essentially that's what they're getting. During the first consultations, anything is possible. Most of the time, we end up with doing some simple blood tests that can be done on the same day in the clinic. But certainly a treatment plan will be devised. It can involve, in my case, a lot of endoscopy-related procedures, and I think certainly for certain surgical conditions like a lump or abscess, it ends up with a discussion about what the surgery will be like. If the patients are able to decide on the same day, everything will be planned and laid out, and then leading up to surgery. And of course, if they can't, then we give them their options. We run through 2 options, 3 options, whatever number of options that could be suitable, and then they think at home. And then of course, certainly for conditions that can be treated medically, then they get medications, and usually I tend to see them in about 1 or 2 weeks time because we want to assess our treatment response. So I think the term gut health is fairly broad in nature. Most patients don't walk in asking for, can you tell me my gut health? I think a lot of times it involves more of they having certain symptoms that they are experiencing. And of course, it still boils down to the same thing, which we take as much detailed history as possible. We examine the patients sometimes if we do need to. And then I think that boils down to what kind of investigations and what kind of procedures. And I think notwithstanding, a lot of patients actually come wanting just some form of a reassurance, or even if possible, an answer, which often tends to reassure them as to what they have going on in them. And I think that often is what I tend to want to give. I may not be able to give a good diagnosis or definite diagnosis at the first instance, but what I often reassure my patients is I can be quite confident to say whatever you just described to me doesn't seem to be anything serious. And I think that often gives them that reassurance when they want to. So I think the primary tool for most colorectal surgeons that we do is a colonoscopy, and of course, certainly, depending on where your symptoms are, a gastroscopy, which is a scope of the stomach, and of course, a colonoscopy is a scope of the colon. So sometimes we also assess for other conditions around the anus. Commonly, a lot of cases involves blood in the stools, which turns out to be hemorrhoids. And then, of course, there are still a fair number of colorectal conditions that are fairly common. So we have got things like fistulas, we have got things like abscesses around the bottom, and these form the largest majority of what we do. Going back to colonoscopy, so a lot of times this is our primary tool, as I mentioned earlier. And the whole intention behind this is there are a lot of people with polyps in the colon. Certainly, what I always give an analogy is that as one gets older, in your 40s, having polyps is just like you're expected to have white hair. In fact, if you don't have any, then I would call that to be quite unusual. And I think certainly during a colonoscopy, when we choose to remove the polyps as and when we find them, that actually prevents that particular polyp from developing further into any eventual tumor or cancer in the future. But certainly, a lot of the symptoms are of course related to something in the bowel. Bearing in mind that a lot of us do a lot of general gut work, that means we get a lot of symptoms related to the stomach, certainly things related to gallbladders, and of course a lot of other general surgical conditions like hernias. And I think certainly for myself, I do a lot of skin cancers and skin lumps. So I think that's when I get a fair number of my patients coming in for that too. So I think what I want patients coming out from the consultation to have is, as a first off, they get options, choices laid out for them. And in doing so, of course, clearly some form of customized care. So much as in you get a whole, maybe 2 or 3 possible solutions, I often try to at least provide patients with an option that I feel best suits whatever they are undergoing. Even though, yes, there are other options also available. I want them to walk out of the clinic feeling very clear in the mind what they had. And of course, knowing that they can always contact us whenever they have any questions, even when after they have signed the consent, or if the surgery is just tomorrow, they can still certainly call in or WhatsApp us. If I were to jump forward and digress a little, I want to make every consult not like seeing strictly like a doctor. I think that also explains why I wanted my clinic to be decorated in a certain way, because I want the patients to come feeling not too stressed, not like you're here for an exam kind of thing. So I think that's the value guide that I want to see. I think when it comes down to colorectal health, it always boils down to cancers, or in this case, colorectal cancer. I think colorectal cancer is certainly one of the commonest cancers in Singapore. In fact, for many years in a row, it topped the commonest cancer in Singapore. And it is certainly very, very preventable, either through a colonoscopy, whereby we remove polyps. Now, bear in mind that it's not the case that every polyp becomes cancer, but it certainly is the case that every cancer has to start from a polyp. So if you remove polyps routinely, you actually prevent colorectal cancer from developing. And it is certainly a procedure, a colonoscopy, a procedure that can take only about 15 minutes to 20 minutes to be done, and only needs to be repeated about once every 5 years if nothing major was found, or if it was very clean and we could see very clearly. And so essentially, what I would tell my patients, you get a warranty for 5 years. So I think certainly you can pop on to the website, which is Alpine Surgical Practice. If you search on Google, through there, you have a few ways to contact us. There is definitely, of course, a phone number they can call in. Most people nowadays like to WhatsApp to make appointments. And I think at the same time, that's when my girls will advise as to whether your insurance will cover, maybe a bit estimated how much things will be, or whether it's even the right place to be seeing me for, or whether they should go somewhere else. Clinic-wise, we have 2 clinics. We are at Mount Elizabeth at Orchard, which is opposite Paragon, which often you come via Orchard MRT. My other clinic is actually in the east at Parkway East Hospital, also formerly known as East Shore Hospital or American Hospital. And these are the 2 clinics that I see patients at. Of course, when we do procedures and all, it can be a whole variety of hospitals depending on the facilities, what we want to do, and of course, certainly if the patients wish to.